Hello everyone, welcome to Module 3, Treatment and Daily Management. Here's the truth. While there may not always be easy cures, there are powerful ways to manage sickle cell and live a healthier, fuller life. Many people living with sickle cell go to school, they build careers, they run businesses, they raise families and pursue their dream. But one thing is common among those doing well. They take management seriously. Management comes down to consistency, not motivation, not luck, consistency. Because sickle cell management is really about reducing the chances of crisis before they happen. Let's start with everyday habits. Hydration, that's one of the habits. Hydration is not optional. Water helps blood flow more smoothly through the body. Remember from the last module, when the body becomes dehydrated, the blood becomes thicker, they break down easily, increase the risk of blood blocked vessels, and of course, pain crisis. For some living with sickle cell, drinking water is not just a healthy habit, it is part of treatment. For example, two people may spend the whole day outside under the sun. One gets mildly tired, the other may end up in severe pain because their body reacts differently. Now, that doesn't mean it is certain that you have crises all the time. You can be under the sun and you stay hydrated or in a shaded area. That will help not to provoke crisis in someone with sickle cell. And another habit is proper rest. Lack of sleep, overworking, constant exhaustion places stress on the body. And when the body is constantly stressed, it becomes harder to recover and function properly. Some people ignore warning signs because they don't want to appear weak. But listening to your body early can prevent something worse later. Sickle cell causes insomnia. If not all people, most people with sickle cell, I myself have experienced insomnia, I still do. Most of the times it's hard to find sleep. Not that it's any fault of yours, but it's just something that is connected to sickle cell. Probably the medications causes insomnia and prolonged painkillers. You're always on constant painkillers. And sometimes one of the side effects of these painkillers is insomnia. So it does happen. So people find it difficult to find sleep, but there are natural ways to help boost your sleep. And when it comes, don't fight it so that it doesn't go away. Another habit is balanced nutrition. The body needs good food to produce healthy blood cells, fight infection, and maintain strength. This doesn't always mean expensive meal. Regular meals is okay. Sometimes it simply means eating regularly. Avoid excessive junk food, include fruits, vegetables, proteins, most important, proteins and nourishing food consistently. That will help keep your blood production steady. A weak body struggles more during crisis. Another habit, medical support. Daily habits alone, they are not enough. Medical care also plays a major role. Medications, let's talk about the medications. Some medication help reduce the frequency and severity of crisis. Examples of such medication, folic acid, which is a must for every person living with sickle cell, and then you can have additional medication like hydroxyurea, Adagvio. I'm on Adagvio too. It's a monthly infusion treatment. What it does is it works by helping the body produce more healthy types of red blood cells, which can reduce complications for many patients. But medications only work properly when taken consistently and under medical supervision. That's why regular hospital visits, checkups is very important. Many people only go to the hospital when things become serious. But preventive care helps doctors monitor the body before major complications happen. Regular visits can help check the blood levels, the sign of infection, organ health, growth, and development in children. If you're struggling with your intake of water too, regular checkup is one way to get hydration in the doctor's office too. Early attention often prevents bigger problems later. Another preventive care. Preventive care also includes treating infections quickly, taking prescribed medications correctly, vaccinations, knowing personal triggers, avoiding things that commonly lead to crisis for you as an individual. In simple terms, management is proactive, not reactive. This is why sickle cell management cannot be a when I feel like a system, because sometimes the body gives warning quietly before it gives them loudly. Skipping water for days, ignoring fatigue, missing medication, avoiding checkups. These small decisions can build up over time. Think about someone managing diabetes or high blood pressure. Even when they feel okay, they still have to watch their lifestyle carefully and medications intake properly and correctly. Sickle cell management is similar. You don't wait for damage before taking care of the body. For someone living with sickle cell, management can greatly improve quality of life. But many people still ask an important question. Can sickle cell actually be cured? Let's address that honestly on the next module. Thank you.